Good morning and welcome to Frontiers of Knowledge segment of Dr. Lamba's Awakening Call. We are aware that knowledge is ever widening, the horizons are ever widening. But are you aware, by the way, that yesterday, when the sun set on a town in America, but essentially near Canada, it will not rise again this year? The sun set yesterday evening in a town called Barrow in Alaska. And now the sun would rise again in the same town on January 23. 67 days of total darkness for 5,000 inhabitants of the city of Barrow, which you cannot go by land, you have to go by air. And then in the summer, from May 11 to July 31, the sun never sets. So from November 18 to January 23, the sun never rises. And from May 11 to July 31, sun never sets. These people will see the sun again on January 23. Well, that is what our world is. Now, coming to the field of knowledge, we find that inventions are everyday occurrences, but those everyday occurrences are a result of years of hard work. And this year we have seen number of technologies. The latest one being the vaccine for COVID-19, which has been tested and a couple of vaccines have been accepted. But is that enough? You'll be amazed that about 100 new inventions took place. And the most important emerging technologies of 2020, I'm going to talk about them today. From digital replicas who will replace human bodies to make clinical trials faster and safer, from electric planes to technology sensors that can see around the corners. This year's list of inventions is inspiring, awe-inspiring, and heartening. So, what are the major technologies? The first one is, of course, the microneedles. Now, what are the microneedles? We know that we need injections every day. And these injections, some of them use them every day, sometimes people twice a day, but everybody, whether it's for injecting medicine or for the tests, you need it. So now tiny needles have been invented, microneedles, and the total needle is less than the depth of a sheet of paper. So you can well imagine how almost invisible the needle would be. And the depth is just a sheet of paper, and the width is a human hair. Benefit: pain free injections and blood testing. These microneedles will penetrate the skin without troubling underlying nerve endings, can be attached to syringes or patches, even mixed into creams. This could allow the blood test to be done at home, sent to the lab for analysis on the spot. And because these don't require expensive equipment at high level of training, testing and treatment could be delivered in underserved areas, far flung areas where Medicare may not be easily accessible. This is really a technology, especially for children, elderly people, and the people living in remote places. But then that's not alone. As I told, there are about 10 major technologies. I'm going to talk about those. This is the first one. The second one is some powered chemistry. Now, making money into chemicals, we rely on the fossil fuels. But a new approach is going to reduce the emissions by using sunlight to convert waste carbon dioxide into useful chemicals. Recent developments in the sunlight activated catalyst needed for this process and a step towards creating solar refineries to produce useful compounds from waste gas. Now, till now, we have been using sunlight directly to create energy, but here sunlight is being used to convert the waste gas which is already there into useful compounds. And this could be turning everything from medicines and detergents to fertilizers and textiles. So the whole panoramic use of equipment or everyday needs, which ultimately the waste would be converted into useful compounds. And the instrument for that would be sunlight. The third one I referred to earlier is virtual patients. You know, the vaccines take a long time and they're tested ultimately primarily on the human beings after the guinea pigs. So swapping humans for simulations to make clinical trials faster and safer sounds simple, but science behind it is not. What they have done is they have taken data from the high respondent images of the human organs, fed it into complex mathematical models, and those models are mechanisms that control the organ's function. Then computer algorithms resolve the resulting equations and generate a virtual organ. So the heart's mechanism with a virtual algorithm creates a heart. The real organ is created, virtual organ. But the behavior of that virtual organ is like the real organ. And this virtual organ or a body system can replace people in the initial assessment of drugs and treatment benefits, make the process quicker, safer, and less expensive. Fourth one is spatial computing. We have been hearing of computing, then quantum computing, and now comes spatial. Spatial computing is the next step in bringing together physical and digital worlds. As a matter of fact, we are already seeing with virtual reality and augmented reality apps. These are coming. As with virtual reality and augmented reality, what they happen is they digitalize objects that connect via cloud, allow sensors and motors to react with one another, and create a digital representation of the real world. But now we are going still further. As I said, we are going to spatial computing. We are adding spatial maps that let a computer coordinate, track, control what? The coordination between the digital and the physical world. So they'll become one. There'll be perfect synchronization of the digital and the physical world. The benefits? It will bring new developments in how people and the machines interact. So the robots will not be seen as competitors. And this will be useful in industry, in healthcare, in transportation, and in our everyday work at home. The fifth one is digital medicine. So, what's that digital medicine? Let me tell you, digital medicine, the way it's coming, won't replace doctors tomorrow and next month and next year. But the apps that control monitor conditions and administer therapies could enhance their care and support with limited access to the health services. Now, the people living in far off places, cut off from the advanced Medicare, would be able to use them. You wear smartwatches already, they detect whether you have an irregular heartbeat or similar tools that help with breathing disorders, depression, Alzheimer's, and more. So much so that the pills containing sensors are being developed that send data to the apps to help detect things like body temperature, stomach bleeding, cancerous DNA, and everything. So that digital medicine is Medicare is going to replace the system of assessment and send that result directly to the doctor, maybe even a computer doctor, and the computer analyzes it, sends the medicine back by the signal. So that is going to happen according to the people who are working next about 5 years. Then comes electric aviation. What they're going to do is, or they're doing is electric propulsion, which allows air travel to cut out carbon emission slash fuel costs, bring about big noise reduction. And number of organizations have done a wonderful job in that, whether it's NASA and Airbus, they are now the leading ones. And already the long haul electric flights may be ready next year. There are 170 electrical plane projects in development today. They are for private travel, corporate travel, and commuter travel. And Airbus says that they'll have 100% electric planes ready taking off in the next decade. And now comes something which would be of interest to all the people living in the houses. Do you know that the most important component of building is cement? And nowadays, in the world, 4 billion tons of cement is used every year. 4 billion tons. And how is it produced? By burning fossil fuel. And this cement production alone is responsible for 8% of the global carbon dioxide emissions. So, urbanization is going to increase. We need more houses, more buildings. And the demand for cement would be 5 billion tons in the next couple of years. So now the scientists have worked and they have developed low carbon approach, tweaking the balance of ingredients used in the process and employing carbon capturing and storage technologies to remove emissions and take cement out of concrete altogether. I told you last time that the batteries have been developed. The batteries will take out the carbon. And the eighth technology is quantum sensing. Imagine self-driving cars that can see around the corners, portable scanners that can monitor the brain's activity. So quantum sensing could make things much more of a reality. Quantum sensors operate with extreme level of precision by exploiting the quantum nature of things. They use the difference between the electrons and different energy states as the base unit. These systems are very complex. But now what they're doing is they're building small, affordable examples so that the new uses of quantum sensing can be there. Already, robot vacuums have come which sense and operate. And now comes something of very much interest to me, that's the green hydrogen. We know hydrogen, but here is the green hydrogen, absolutely environment friendly. When hydrogen burns, the only byproduct is water. You are aware of that. And when it is produced through electrolysis using renewable energy, it becomes green. So earlier this year, it was predicted that green hydrogen will be a $12 trillion market by 2050s. That means 3 decades, and hydrogen will be $12 trillion market. So the people who go in for this product now are going to be really rich. So it could have a key role in energy transition. It will help decarbonize sectors, especially shipping and manufacturing. They are very hard to electrify. Shipping is very difficult. Manufacturing, because they need high energy fuel. And all that will be changed to hydrogen, which will be calming the people who are afraid of the global warming. And now the last technologies are the whole genome synthesis. What's happening is improvement in the technology needed to design genetic sequences are then introduced into microbes, making it possible to print ever larger amount of genetic material and alter genomes more extensively. It will help sustainably produce chemicals, fuels, construction material from biomass, waste gases, and it could also allow scientists to design pathogen resistant plants. So, no need of insecticides, no need of pesticides. All those harmful things will be removed from the shelves. This will open the door to even possible misuse, but cure for the genetic diseases. Now, the most of genetic diseases, cancer, diabetes, all these would be possibly things of the past. I'm saying possibly because you never know what might happen in the meantime. But these 10 technologies are the most important technologies emerging this year, and they'll have a huge impact in the next couple of decades. We are going to see the results of all this, and this is really heralding what Elder Success says, a brave new world. And we are participants and witnesses to this brave new world being created by these emerging technologies. Thank you.